Pregnancy is a remarkable journey that begins when a fertilized egg implants itself in the uterus, ready to grow and develop. But what happens when that egg ends up in the wrong place? Today, we're taking a closer look at a rare but serious condition known as ectopic pregnancy. Let's learn what causes it, how to recognize the signs, and what can be done to treat it. What is ectopic pregnancy? Normally, a fertilized egg travels down the fallopian tube and implants in the uterus, where it can grow safely. But in an ectopic pregnancy, the egg implants outside the uterus, most commonly in the ampulla, the widest part of the fallopian tube. Because the fallopian tubes can't support a growing embryo, this condition can cause serious complications. Now, what causes ectopic pregnancy? What causes ectopic pregnancy? The main issue is anything that affects the structure or function of the fallopian tubes, including tubal obstruction. A blockage in the fallopian tube can trap the fertilized egg, preventing it from reaching the uterus. Congenital malformations. Some women are born with abnormally shaped or narrowed tubes. Other risk factors include pelvic inflammatory disease (PID), often caused by sexually transmitted infections. PID leads to inflammation and scarring in the reproductive tract. In vitro fertilization (IVF), assisted reproductive techniques can sometimes increase the risk of abnormal implantation. Smoking. Nicotine affects tubal motility, which may prevent the egg from reaching the uterus. Previous ectopic pregnancy. Having had one before significantly raises the risk of it happening again. Now, how can we recognize it early? The early signs may be subtle but critical. Missed menstrual period. The first clue might be a period that doesn't come as expected. Lower abdominal or pelvic pain. This pain can be sharp, cramping, or one-sided. Dark red or brown vaginal spotting. Unlike regular menstruation, this bleeding is usually lighter and discolored. Positive Cullen's sign. In advanced or ruptured ectopic pregnancy, you may see bruising around the navel, indicating internal bleeding. If the ectopic pregnancy continues to grow, the tube may rupture. This leads to sudden severe abdominal pain, referred shoulder pain, caused by internal bleeding irritating the diaphragm. Signs of shock, such as dizziness, weakness, pale skin, low blood pressure, or a rapid heartbeat. A ruptured ectopic pregnancy is a life-threatening emergency. Immediate medical attention is vital. Managing ectopic pregnancy requires timely and precise nursing care. Here are the key interventions every nurse should carry out. The first step is a thorough assessment. Nurses must gather the client's health history, monitor for symptoms like abdominal pain and vaginal spotting, and accurately record vital signs, especially pulse, blood pressure, and respiratory rate. These values help detect early signs of shock or internal bleeding. Observation of vaginal bleeding is essential. Dark red or brown spotting may indicate an ongoing ectopic pregnancy, but sudden heavy bleeding or abdominal rigidity may point to a rupture. Nurses should be prepared to start for fluids, position the client to maintain circulation, and alert the healthcare team immediately if shock symptoms appear. If the ectopic pregnancy is advanced or rupture is suspected, surgery may be needed. Nurses must prepare the client both physically and emotionally. This includes fasting status, consent forms for access, and preoperative education. Ensuring the surgical team is notified and the client is transported safely is also crucial. Postoperative or post-treatment care includes administering prescribed antibiotics to prevent infection. Additionally, if the client is Rh negative, rhodioimmunoglobulin is given to prevent isoimmunization, protecting future pregnancies. For unruptured, early detected ectopic pregnancies, surgery can sometimes be avoided. Methotrexate is the first-line medication. It's a folic acid antagonist, which means it stops cells from dividing and growing, ending the pregnancy safely without surgery. To wrap up, ectopic pregnancy is a serious condition that requires early recognition and prompt intervention. As nurses, it's our responsibility to stay alert for warning signs, provide compassionate care, and take quick action to prevent life-threatening complications. Thank you for joining this lesson. Stay informed, stay prepared, and continue making a positive impact through nursing care.